Hello and happy April 8th. Today is total solar eclipse day. Very exciting indeed. Come read the news with me while I have my second cup of coffee. Also, just as an aside, today is my daughter Sophia's 6th birthday, so today is a very special day. It's also why, I don't know if you could see it, but I have some pink tinsel in my hair because we're celebrating her party later, and we got some matching pink tinsel. Anyway, this first article comes to us from Reuters. This was published on April 2nd. Excuse me, Maccabee. The title is Gene Involved in Cell Shape Offers Clues on Left-Handedness. So this is really cool. This is an area of active research, and there's this new study that sheds light on a genetic component of left-handedness in some people. So basically, researchers identified this rare variant or variants of a gene involving involved in controlling the shape of cells and found them to be 2.7 times more common in left-handed people. So the article discusses the role of genetics in determining whether someone is left or right-handed. Traditionally, and I'm sure you've heard this, people will say that handedness is associated with dominance of one brain hemisphere. So it's like, are you left-brained? Are you right-brained? And really this study investigates the role of specific genes that code for proteins called, and I'm probably going to botch this, tubulins. I'm looking at my husband here to see, do you know? Tubulins. Okay, excuse me. Okay, tubulins. These proteins are important for the structure of cells. So the researchers who conducted this latest study found that a gene called TUBB4B has a higher rate of variations in left-handed people. And these variations mostly affect the protein sequence without significantly changing its overall structure. So basically, it seems like there might be some rare genetic variations that might play a role in determining handedness. Very interesting. This is published in NPR. The title is Mental Health Care is Hard to Find, Especially for People with Medicare or Medicaid. So the article is detailing the mental health crisis in the U.S., rates of suicide and opioid deaths rising in the past decade. Children's mental health was declared a national emergency. And we know that access to care in general is a really big problem, and access to mental health care is even more difficult. It's extremely limited. So there was this new government report that was released this past week. The report was published by the Department of Health and Human Services, Office of the Inspector General. And it really highlighted that Medicare and Medicaid is facing a dire shortage of mental health care providers. So the actual report looked at 20 counties with people on Medicaid, traditional Medicare, and Medicare Advantage plans. And together they serve more than 130 million enrollees, which is more than 40% of the U.S. population. So this is a huge segment of the American population. And just as a reminder, Medicaid serves people on low incomes. Medicare is mainly for people who are 65 years and older or those with certain disabilities. The report found fewer than 5 active mental health care providers for every 1,000 enrollees. On average, Medicare Advantage has 4.7 providers per 1,000 enrollees, whereas traditional Medicare has 2.9 providers and Medicaid has 3.1 providers for the same number of enrollees. Some counties fare even worse, with not even a single provider for every 1,000 enrollees. This is really terrible. Roughly 1 in 4 patients had to travel more than an hour to their appointments. 1 in 10 had to travel more than an hour and a half each way. Some patients. All right, so this next article comes from The Hill. The title is The CDC Issues Bird Flu Infection Health Alert. So the CDC issued a health alert this past Friday. Basically, they were sharing that there was a confirmed human infection of the bird flu. It was a worker on a commercial dairy farm in Texas who developed conjunctivitis which we know is pink eye, on March 27th, and then tested positive for HPAI, which is highly pathogenic avian influenza. The patient did not report any other symptoms, was not hospitalized. He received antiviral treatment and is recovering. Household members living with the patient did not become sick. So that was good news. There were no additional cases of human infection with HPAI, H5N1 virus, which is associated with the current infections in dairy, cattle, and birds in the U.S., and no human-to-human transmission has been identified. So the CDC is doing more testing. They looked at the patient's virus genome and sequences from cattle, wild birds, and poultry. It found minor changes. Let's see. And they both lack changes that would make them better adapted to infect mammals. So long story short, this patient in Texas was the second person in the U.S. to test positive for the disease. The first was a person in Colorado in April of 2022 who had contact with infected poultry. So we do know that the virus historically has been shown to be deadly. It kills more than 50% of its human victims, based on data from 2003 to 2016. The current outbreak has spread to affect 82 million birds in 48 states, the worst outbreak of bird flu in U.S. history. But risk remains low for the general public, but people with jobs or recreational activities that could expose them to infected birds, cattle, or other animals are at higher risk and should take precautions. All right, this next article comes from AP News. The title is "Many Cancer Drugs Remain Unproven 5 Years After Accelerated Approval, a Study Finds." So this program, the Accelerated Approval Program, it was created in 1992, initially to speed access to HIV drugs, but today 85% of the accelerated approvals go to cancer drugs. And this new study found that the majority of cancer drugs granted accelerated approval don't actually demonstrate such benefits within 5 years. Now, again, what the program does is it allows the FDA to grant early approval to drugs that show promising initial results for treating debilitating or fatal diseases, and in exchange, drug companies are expected to do rigorous testing and produce better evidence before gaining full approval. Patients get access to drugs earlier, but the trade-off means that medications sometimes don't pan out. So really, this is for folks who are not responding to other treatments, who are looking for, a possible answer in some new drugs that are being tested. But it looks like, unfortunately, the majority are not shown to be beneficial. So the new study found that between 2013 and 2017, there were 46 cancer drugs granted accelerated approval. Of those, 63% were converted to regular approval, even though only 43% demonstrated a clinical benefit in confirmatory trials. So interesting stuff. I mean, it's still an important program for folks who are looking for possible answers when they don't have any answers elsewhere, but unfortunately, not the results that we were hoping to see. And then finally, I feel like we had to do an article on the total solar eclipse. So this comes from AP News. I'll keep this brief. The title is "Huge Crowds Await a Total Solar Eclipse in North America. Clouds May Spoil the View." I know folks who have traveled all over to see this eclipse. So this says that millions of spectators along a narrow corridor stretching from Mexico to the US to Canada eagerly awaited Monday's celestial sensation, a total eclipse of the sun. So the best weather is expected at the tail end of the eclipse in Vermont and Maine, as well as New Brunswick and Newfoundland. Let's see. It's promised to be North America's biggest eclipse crowd ever, thanks to the densely populated path and the lure of more than 4 minutes of midday darkness in Texas and other choice spots. Almost everyone in North America is guaranteed at least a partial eclipse, weather permitting. Hope you all have front row seats and get to enjoy. I'm going to check it out right before my daughter's party. I think we peak at around like 3:40 p.m. and then her party starts at 4. So happy Eclipse Day, everyone.